22 years ago, almost to the day, I was sitting in a plane for Kilimanjaro Airport, Tanzania. I had never been to Africa before. I was about to graduate from business school, and just like most of my classmates, I was about to start a 40-year career in the corporate world, in Paris, London, or New York. But I wanted to do something different, at least for a few months, something I would never do again. And I ended up in Tanzania. A few months became several years in Tanzania, Cameroon, Equatorial Guinea. 22 years later, I live in Paris with my wife and our 3 kids, but I still spend about 50% of my time in Africa, advising governments, NGOs, and the private sector on healthcare. And what I found in all these years is that despite the difficulties, great progress has been achieved. And most importantly, much more is to come. Let's take the example of HIV/AIDS. Between 93 and 98, 10 of the 25 drivers I was working with died from AIDS. Well, officially, they didn't die from AIDS, because by then in Tanzania, AIDS was not considered as a disease. They died from opportunistic infections. Today, AIDS is a priority for the Tanzanian government, and about 500,000 people are under antiretroviral treatment. Most of them will not die from AIDS. As I said, great progress has been achieved. Sadly, 500,000, it's just 1/3 of the HIV-positive population in Tanzania. There's still a long way to go. And that's what we often hear in Africa. Some progress, but still a long way to go. So what's the reality today? Africa represents 14% of the global population, but 24% of the global disease burden. And worse, 54% of communicable diseases, 54%, whereas it only has 2% of the doctors in the world. Still, despite this very low starting point, I am convinced Africa could develop sustainable and effective health systems in the next decades. Something developed economies, the US, France, or the UK, have not been able to do. So how come Africa, with so few resources and capabilities, could succeed where others have not? Well, Africa could leapfrog its health systems by choosing a different route, by taking advantage of the many innovations that are available today, scaling them up and integrating them. Let's take the example of Nigeria. Nigeria is the most populous country in Africa, with 185 million inhabitants today, 275 million by 2030. Let's make a very simple calculation. What would it take to train enough doctors in Nigeria to reach the same number of doctors per capita than, say, the UK? Nigeria has today 67,000 doctors. By 2030, that number may be close to 100,000. But to match the UK number, Nigeria would have to train an additional 700,000 doctors, multiplying by 12 the current number. And with current training capacity, it would take more than 300 years. So Nigeria cannot and should not try to replicate the UK model. Nigeria should take a different route. And I have no doubt that it can be done. Nigerian health system is still nascent. You could develop it right from the start. Can almost start from a white sheet of paper. No legacy, limited vested interest. No expensive, over-sophisticated hospital to maintain. Nigeria could even invest in areas where developed economies are struggling. I remember one of my first discussions with the former Minister of Health of Nigeria. While we were talking about health reform, he told me, "You know, Mathieu, I am not the Minister of Health. I am the Minister of Disease. The vast majority of my budget goes to drugs, doctors, hospital, not to prevention." Whereas investing in prevention before people get sick, that's something Africa could do, especially because it's not yet crippled by the burden of chronic diseases. And there are enough innovations available today for Africa to choose that different route, to reach more advanced development stage without accumulating inefficiencies, without waiting 300 years. But when I say innovation, I am sure you hear technology, state-of-the-art technology. And too often, when a Minister of Health is taking office, the first things he thinks about is investing in the latest MRI, or worse, in a world-class teaching hospital for his hometown. That's visible, that's exciting, it flatters egos. But that's certainly not the most effective way to improve people's health. Don't get me wrong, technology is key. Technology can enable leapfrogging. It actually did. In Kenya, the African Medical and Research Foundation offers online training for the 20,000 Kenyan nurses. Through this novel approach, they have been able to increase the training capacity from 100 nurses to 1,000 nurses per year, reducing the average cost by 95%. But innovation is not just about technology. One can innovate in changing behaviors. Prevention is a good example. One can also innovate in operating models, the way you organize healthcare. And one of the most fascinating examples I have met is an NGO called Mothers to Mothers in South Africa. Mothers to Mothers is dedicated to preventing the mother-to-child HIV transmission. This transmission is a key challenge in Africa. Without treatment, the transmission rate can be as high as 40%. Whereas with proper treatment and basic education, those 40% can be reduced to 2%, from 40% to 2%. Unfortunately, in most African countries, doctors and nurses are overwhelmed. They're struggling with limited resources and limited time to educate pregnant mothers. As a result, about 600 infants are being infected by HIV every day in Africa. So Mothers to Mothers came with a great idea. They're using mothers living with HIV to educate HIV-positive mothers in preventing the transmission. Replacing nurses by knowledgeable mothers, this is really smart. And as of today, Mothers to Mothers has been able to train 1.2 million mothers in 9 African countries. This innovation is called task shifting, moving a specific task from a highly qualified health worker to a less qualified health worker. A pathway that could be worth further investigation for both developing and developed economies. So this was just a snapshot of innovation at play in Africa. And there are dozens of pilots that are being run today by governments, counties, social entrepreneurs, NGOs, or large corporations. They address all the dimensions of the health system: workforce, service delivery, medical products, financing, governance. But if we have all those great ideas, why are we facing such difficulties? Why is life expectancy in Nigeria still 28 years shorter than in the UK? Well, there are at least 3 intertwined explanations: lack of scale-up, lack of integration, and lack of critical mass and systemic effect. Scaling up is a challenge. Running a pilot in a village, in a district for 5,000, even 50,000 patients is doable by most organizations. But most initiatives fail to reach 5 million or ideally 50 million patients. Why does it fail? Well, taking risk on a small scale is doable by most entrepreneurs or NGOs. But managing financial and execution risk on a broader scale requires further support. And too often, entrepreneurs, NGOs tend to be overprotective with their baby. They're not willing to make the changes that are required for scaling up or for integration into the health systems. Last, a handful of innovation is not enough to transform the system. You need to reach critical mass, launch many initiatives at the same time, addressing several dimensions of the health systems at once: supply and demand, affordability and quality, infrastructure and policy, and more. So does that mean that all those promising initiatives are bound to stay at the pilot stage? No. I'm actually very optimistic. I am optimistic because I'm seeing more and more leaders that are taking the right steps. In Ogun State, Nigeria, the Minister of Health, Soyinka, invited the World Economic Forum and its partners to rethink, to leapfrog Ogun health system, to assemble all the relevant initiatives, all the innovations that are available today in Ogun State to develop an effective health system. And this has a serious chance to work. Ogun has most of the ingredients in the recipe for success. Economic growth, emerging middle class, rising demand from the patients, availability of international aid, political will, and most importantly, a leader that is willing to take a different route. A leader that is willing to leverage the many innovations that are available today. And a leader that is willing to collaborate with the many partners, NGOs, civil society, entrepreneurs, large corporations, that are willing to contribute to the development of an effective health system. So this is why, despite the dramatic headlines, I am convinced that some African countries could, in the next 10 or 20 years, become a worldwide reference in terms of healthcare provision. And this makes me very hopeful about Africa's future. Thank you.